Welcome to Congressman Brindisi's third coronavirus Tele-Town Hall. I'm Sarah Borman, Anthony's District Director, and I'll be your moderator this evening. Thank you for joining us for an informative discussion with questions and answers about COVID-19. In addition to hearing from the Congressman this evening, we've got a few healthcare professionals on the line to answer your questions. We're going to be starting the call shortly, but we're going to let folks continue to dial in for just a few more minutes before we get started. An important note is that in order to ask a question, you just have to press *3. That's *3 to ask a question. For folks just joining us, welcome to Congressman Brindisi's third coronavirus Tele-Town Hall. I'm Sarah Borman, Anthony's District Director, and I'll be your moderator this evening. In addition to hearing from the Congressman, we've got a few healthcare professionals on the line to answer your questions. In order to ask the question, all you have to do is press *3. That's *3 to ask a question. Now, we do anticipate receiving a lot of questions this evening. We've got a lot of questions from the prior two, and we're going to do our best to get through as many of them as possible. But if you don't get to ask your question, please hold on the line and leave a message for us at the end so that we can get back to you. We'll get started in just a bit. Just want to remind everyone that the way to ask a question is to press *3. That's *3 to ask a question. Welcome to the folks just joining us, to Congressman Brindisi's third coronavirus Tele-Town Hall. We're going to get started in just a moment. In addition to hearing from the Congressman this evening, we've got a few healthcare professionals on the line to answer your questions. In order to ask those questions, you have to press *3. That's *3 to ask a question. We'll get started in just a bit. All right, let's get this call started. Anthony, do you want to kick us off with some remarks?
Sure. Thank you, Sarah, so much for moderating our call tonight. And I want to thank all of you for joining the call today and taking some time out of your afternoons. Like many of you, I understand how concerned you are at this time and how desperate you are for answers. That's why we are holding this event tonight. We want to answer your questions, provide the information you need to protect yourself and your family, and give you confidence that officials are doing everything we can to keep our community safe. Tonight, you will hear from experts from SUNY Upstate Medical University and Lourdes Ascension Hospital in Binghamton. Now is the time for due diligence, and while health officials do their jobs, we all have a duty to do our part. Even those who are young and healthy need to consider the elderly and people with underlying health conditions. We are a community and rely on everyone to do their part. That means following local, state, and federal guidelines, but also doing your part at home to stay healthy. Follow CDC guidelines, wash your hands, cover your coughs and sneezes, and stay home. I'll give a brief update of some of the actions Congress has taken to address the pandemic and protect our public health. Last month, Congress passed the Families First Coronavirus Response Act. This bill, supported by Republicans and Democrats, will make sure we have much more coronavirus testing, which we are now seeing, establishes paid emergency leave, and gets critical emergency dollars to the counties across our district. I worked hard to ensure all our counties received the money they needed. We are already seeing some of those dollars come to our communities. Our local counties received more than $30 million in the 22nd District and grants for some area medical institutions. And I'll continue to fight for resources for our community. Last week, Congress passed and the President signed the CARES Act to provide checks to most Americans, relief to our small businesses, and deliver critical resources and PPE to our medical institutions and frontline workers. That legislation will do a lot of good things for families and small businesses, including a huge expansion of the unemployment insurance program, direct payments of $1,200 to most people, $150 billion for our hospitals, money to replenish the strategic national stockpile and get medical supplies to our doctors, nurses, and first responders. The legislation also includes nearly $9 billion for child nutrition programs, for food purchase, and more money for the food banks so people don't go hungry. The list goes on. I know you will have a lot of questions as this gets implemented. If we're unable to get to your question tonight, feel free to stay on the line and leave a voicemail or call my office. This fight isn't over. In fact, experts say it's just starting. New York is now the epicenter, and we have to make sure people are safe and healthy. I've heard from farmers, businesses, schools, local governments, and much more to make sure we get what we need. From the shores of Lake Ontario down to the southern tier and everywhere in between, we are in this fight together. The coronavirus knows no political party. It is something we have to work together to address. As always, my office is here to serve you, so I will be listening to you and fighting for you in Congress. Now I am working with local governments, business large and small, and members of both parties to make sure we get more resources on the ground, protect healthcare workers, support our local economies and family farms, and take into account our rural communities and school districts. With that, I will turn it back over to Sarah.
All right, thanks so much. Just want to remind everybody, if you've got a question, press *3. That's *3 to ask a question. So our first panelist is Dr. Robert Corona, CEO of SUNY Upstate Medical University. Dr. Corona, did you want to give us a few words?
Yeah, thanks, Sarah, and thank you, Congressman, for inviting me this evening. Just a brief overview of SUNY Upstate. We're the region's academic medical center, and that means that we have a few colleges, medical college, nursing, health profession, and graduate college, and 2 hospitals with a combined number of 750 beds. We've been asked by the governor to double that, so we've been making changes within our institution to ramp up our ability to accommodate that many beds, pushing into the region of 1,500. We've been working diligently preparing for the surge. We have a military-style incident command that meets twice a day with infectious disease specialists, logistics experts, supply chain people. It's 75 people working really diligently. I'm also a pathologist, and so heavily involved in the laboratory testing, which I know a lot of people have questions about. So we are trying to find every possible opportunity to improve our testing and improve our knowledge. We had a conference call with our specialists over the weekend with doctors in the Wuhan province of China who dealt with the original cases of COVID. They gave us a lot of information on how to handle patients on ventilators and how to help with diagnostics, what therapies worked, what therapies didn't work. So we are working on this 24/7. Thank you.
Thank you so much. Just a reminder for everyone on the line, if you've got a question, it's *3 to ask a question. Next on our panel is Mr. Sean Mills, Chief Financial Officer of Lourdes Ascension Hospital in Binghamton. Mr. Mills, would you like to give us a few words?
Yes, I would. Thank you. Congressman, I would like to thank you as well for the invitation. We're excited to participate, and just to provide a little bit of background for Lourdes, we are a community-based provider in Binghamton, New York. We are a part of Ascension, which is a national health system. And so we are certainly approaching this with a local presence, but we have a national system that is helping us to understand and manage through this scenario. From an organization perspective, we have an acute care presence, but we also have a very large physician network of about 250 providers, and many of those providers are primary care physicians and really offer a front line in terms of interacting with our patients. Similar to SUNY, we've been spending much of our time in preparing for an anticipated surge, and we are certainly seeing some modest impact within our community. We feel well prepared for whatever may be asked of us, whether it be local or regional. But we're grateful for the opportunity to share information that we have, and in our own experiences, we help to face COVID-19. Thank you.
All right, great. Thanks so much. Just a reminder, to ask a question, it's *3 to ask that question. So let's ask our first one. We've got Kathy from Johnson City. Kathy, can you hear us?
Yes, I can.
You've got a question?
Yes. I'm living with a person who has COPD and heart disease, and I wondered, if I was to get the virus, what do doctors need to do, and how do I protect the person I live with who's at high risk? Do I need to move out? Does he have to be tested for it if I was to get it? Or how does it work if you're living with someone at high risk and I get it? And
I'm
Want
sorry
me to take this one?
If you would, that'd be great.
Yeah. Well, originally it was thought that people that had additional conditions like COPD or heart disease were the only ones that could get sick. Now we know that to be different, that almost anybody can get sick, but your partner would be vulnerable, and if you had been tested positive for COVID-19, you would get instruction from the physician that would have ordered the test on a proper quarantine procedure. You would not be advised to be in the same house or in the same room. You'd have to likely be masked, and the advice on masking now is ever changing. We may even see this evening that Dr. Fauci recommends people wear a mask when they're out in public. You would have to have monitoring of the patient that had the heart disease and the COPD, and make sure that if you were positive, you tested negative or were quarantined for the 14 days as directed.
All right, great. Thank you so much. Let's see. Let's take another question. We've got Francine. Francine, can you hear us?
Yes.
You've got a question?
Yes. My question is, I'm on Social Security disability, so I don't file income tax forms, and I was wondering about the stimulus checks, if I'm still eligible to get one.
If I could take that question. So if you are a Social Security beneficiary or an SSI recipient who does not file a tax return, you do not have to take any additional action. The process is still evolving, but the IRS is going to be making sure that everyone gets those checks. So you are still going to get the checks. If for some reason you don't, let us know. Call my office. We will reach out to IRS for you. But you should not have to take any additional action. IRS should be proactively reaching out.
All right, great. Thanks so much. We've got a question from Fred. Fred, can you hear us?
Yeah, hello?
Hi, sir. You've got a
Hi,
question?
Yes, I do.
Yes.
The countries that have dealt with this most successfully, South Korea, Taiwan, have done it with extensive testing, both for the population, for healthcare professionals, people on other people on the front line, like first responders. We still seem not to have enough tests. Now that and especially locally within District 22. Can somebody tell me when we're going to get enough tests so that, for instance, we could do, say, community sampling for community spread, just to get an idea of how much COVID we might have in the district?
I can take that one. So right now we've been operating with the premise that everybody is potentially positive. There's probably been COVID positivity around here for months. And the testing had a bit of a hiccup because it was being directed by the Center for Disease Control, and they had some issues with reagents, and eventually everyone's act got together, and now we're starting to see the testing really ramp up. Our state lab is doing a phenomenal job with about a 12-hour turnaround on COVID testing. There have been some problems with some of the commercial labs taking 10 days or so to get the results. We at Upstate are working on a 15-minute test that we think will be up and running by April 13th. We are hoping that the Abbott test that's coming out, which is a point-of-care test that can be put in doctors' offices and has the same short period of time, like 15 minutes, will really help. And having testing available to multiple people so that we can decide who's sick, who's recovered, will help us manage the hotspots better, and also will help us get people back to work. The other thing it's helping us with, we're starting what's called a convalescent plasma therapy therapeutic, where we're taking the serum from plasma from patients that have had COVID, and after they've been tested for hepatitis and HIV to make sure that there's no contaminant, we can give those antibodies to people who are sick with COVID and are not doing so well because their immune system's not taking care of the virus. And this has been shown by the doctors in China that we talked to, and now some other institutions in the United States that are doing it to be a very successful procedure.
So this is Sean Mills. I'd like to add on to what Dr. Corona has said. In our case, very similar experience in terms of where we are at with testing. The only point that I can add on is related to the Abbott test. We expect that for us, that would become something that's viable mid-March. In one of our sister facilities in Chicago, the reagent is available more quickly, and they are completing a parallel test against an existing test that is, able to detect and just ensuring that both tests are reasonably accurate. And so by the time we're able to administer that test locally, we'll have confidence from that other facility's testing.
Great. And that mid-April we're thinking for that test, Mr. Mills?
That's correct.
All right, awesome. All right, let's get another. We've got Brian from Windsor. Brian, can you hear us?
Yes, Carmen Brindisi, this is for a question for you. I work for the Federal Bureau of Prisons, and they had been bus moving inmates prior to after the CDC had recommended that all movement stop. They ended up bringing an inmate in from New Jersey and to Canaan, and it affected the whole camp. Can you possibly look into making sure that there's no bus movement or any excuse me any kind of movement within the Bureau of Prisons system?
Yeah, thank you for the question. I will look into that. You are the second person today that has reached out to me with a concern with the Federal Bureau of Prisons. So I have my staff making an inquiry on that right now. I can tell you, I know in New York State Department of Corrections, I had a conference call this morning with NYSCOBA, the Corrections Officers Union, because we were also hearing about transfers of inmates among state prisons. My understanding from talking to them this morning and also talking to the state that is no longer happening. But we will certainly reach out to the Federal Bureau of Prisons on the issue that you brought up. And if you want to just leave your contact information, we will get back to you once we make that inquiry.
All right, great. Thanks so much. We've got Corey from Beltsville. Corey, can you hear us?
Yes, I can. Thank you, Sarah. Thank you, Congressman, for doing this today. My question concerns our local hospitals that have been, the front line, especially our rural hospitals. They're pretty strapped right now with the response to COVID-19, and they've really had to disrupt their budgets with canceling elective surgery. So financially, they're also worried. I was wondering if there's going to be anything in these relief packages for the hospital and the hospital workers that have been working so hard.
Yep, I can take that one. So there is $150 billion in the coronavirus, the third bill that was just passed and signed into law for hospitals. I have urged, along with Congressman Katko, we just sent out a letter urging the Health and Human Services Department to really prioritize our rural hospitals and safety net hospitals. And the COVID fourth, there's talk right now about a fourth stimulus package, and we are also making a strong case that we need to have more support for our healthcare workers in that package. They're undergoing tremendous risk right now, and we need to make sure that they and their families are protected should something happen to them, and that's something that I'm pushing for in the next coronavirus package as well.
Congressman, this is Sean. I want to thank you for pushing for that, and just to add to that, what has been very helpful for hospitals, CMS is coming up with an accelerated payment program to look at the past 6 months of receipts and allow for hospitals to have access to cash flows in advance, which is tremendously helpful. In addition to that, we see other payers starting to follow suit, whether it be payers in New York or other payers throughout the country, and that is certainly helpful for us as well. But certainly the concern that was shared related to hospitals and their cash flow is one that I think state and federally there's a lot of attention, and certainly Haney's has been an advocate for the hospitals, and it's good to see a lot of activity here to help the hospitals.
Great. Thank you so much. we've got Jamie from Southern Tier area. Jamie, can you hear us?
Yes, thank you so much for doing this today. I have a question regarding our local restaurants. We really want to support our local restaurants. However, I'm at high risk, and we're concerned about bringing food that is made outside of the home into the home. So I was wondering if we could just get some medical opinions or advice on how to go about that.
Well, there is a debate on how long the virus can exist on the various surfaces, and it ranges from hours to days. And the latest data I've seen as far as like cardboard and maybe some of the things that would be in takeout says that it could be up to 2 days. And so what we're telling everybody, and I think this is a good principle to follow regardless of anything that you might come in touch with, is to make sure that your hands are constantly washed and or sanitized with hand sanitizer. The virus accesses the human body by eyes, nose, and mouth, and it's usually your hands touching your face that will contaminate you with the virus. So if you get takeout food or food is prepared, hopefully it's prepared with a good process. But the wrappings and so on, recommend that you wash your hands thoroughly after you unwrap the food and dispose of it. Some people are actually, when they have things delivered, not food necessarily, but packages, they leave them for a couple of days before they touch them and open them, just to be ultra cautious. I don't think it's a high probability you will be infected with the virus, but there is some science that shows that it can exist on surfaces for hours to potentially days.
Hey, doctor, just a quick follow-up on that. Do you recommend folks microwave their food if they're doing takeout when they get it home?
That's a good way. That'll kill the virus. That's not a bad idea. So for the food you can microwave, please do. There are videos now showing how you can divide a countertop into dirty side, clean side, and practice opening up the food on the dirty side, washing your hands, then moving it over to the clean side. I think I don't want people to panic because for the most part the viral load would be minimal, but there is some science to indicate that you could potentially get infected that way.
All right, great. Thank you so much. Let's
You're
take on a question. Kathleen, can you hear us?
I can hear you.
All right, you've got a question?
I do. I work in the healthcare, which I don't want to say which hospital. Question regarding our N95 masks and the protective shield that we wear over our patients for positive COVID. My question is, after going into a room with a positive COVID with our N95, generally I will put another mask over that and a face shield. After donning everything inside, going out, when we take that off, are we to wash it, reuse it? That's my first question, and how many times? And what do we do with the N95? Is that reusable, and do we use that to go into other patient rooms? That's been the confusion.
Well, I think you have to work with your infection control people because every hospital has their own protocol. We have a certain protocol that we follow. We instruct our people every day on how to manage it. So I'd be reluctant to give you specific advice because I'm not really sure about the circumstance.
And I could just add on a little bit too. I know one of the major concerns that our office is really working on right now is making sure that we're getting enough personal protective equipment and face masks into our district. My sister's an infectious disease nurse. I'm hearing about the shortages in hospitals across the district. And unfortunately, it's happening all across the country, which is unfortunate because we want to make sure that our healthcare workers, our frontline workers, have all the tools they need to be able to keep themselves safe and help save lives in the hospital. This is an issue that's going on all over. We're on the phone with FEMA and the Department of Health and Human Services, as well as State DOH, doing everything we can to try and get more of that equipment into our area. We obviously need more things like ventilators as well for patient care. There's just not enough of it right now across the country, and we need to have more. I know a lot of manufacturers are starting to ramp up production. We did include about $16 billion in the CARES Act to help increase the national stockpile. And I think long-term, one of the things that we really need to look at in the country is how do we better prepare ourselves for future natural disasters and health emergencies like a pandemic. So one of the things I'm working on is more of a looking forward, a bill that would require certain products that are deemed essential to a national response be manufactured and procured within the United States, so we're not so reliant on China or other countries for this equipment. We should have a good supply chain of it here in our country.
And one of the reasons why I'm reluctant to give specific advice is because each hospital is working day to day on the number of supplies they have and then the advice they give to the frontline providers. It would be ideal if we had unlimited supplies. We could have a single, very safe protocol, but we've had to modify our protocols based on the amount of supplies we have. And based on the information we're getting from the downstate hospitals, it's going to get worse.
Thank you, everyone. All right, we've got a question from Barry in Cortland. Barry, can you hear us?
Yes. Hi, I'm a truck driver. I'm 67 years old, and I have several autoimmune conditions. The company I work for, they didn't lay anybody off, but I decided to take time off because of my situation, figuring I was in the most vulnerable group for severe reaction if I contacted the virus. And my question is, am I eligible for collecting unemployment, even though I wasn't technically laid off by the company?
So, Barry, you work directly for the company, you're not an independent contractor or something like that?
I don't think he can back and forth after he's...
Okay.
Yep, sorry.
Yeah, if you are having reduced hours, the short answer is yes, you will qualify for that, and you can certainly call our office, but there is help for folks who have reduced hours.
All right, great. Let's go to William from Broome County. William, can you hear us?
Just please, I'll get my husband on. This is his wife. He has the question to ask. Bill, your question's up. I can't. I don't know why you told me.
Hello. I don't hear nothing on here.
Hi, sir. You've got a question?
Yes, I do have a question. I'm in Pennsylvania. My son lives in Binghamton. He's on disability. He worked part-time for the Binghamton School District. Now they're shut down indefinitely, and he cannot live on just a disability. Is he eligible under this new stimulus package to receive unemployment?
Yes, he should be eligible. I would certainly have him reach out to the state unemployment office. I will say I know that we've been hearing from constituents across the district who have reached out to the Department of Labor that there are very high wait times right now. They're just getting a large number of calls and requests into their internet site. So the Department of Labor is trying to get back to people as quickly as possible, but he should be eligible and he should be reaching out to unemployment and try to and file with them.
Great. Thank you so much. Let's go to another question. My gosh, we have so many questions. Philomena, can you hear us? Philomena?
Yes.
You have a question?
Oh, yes, I do. I was wondering, our mail service that we get, I know they deliver our mail. They put it in a box for us. We're at the complex where I'm living. I can't leave my home, but I leave a plastic bag on my doorknob so that someone could get my mail and put it in the bag. What I was wondering is, by spraying it, am I free from getting this virus, or do I have to leave it in the bag for 2 days like I heard on your service there? By leaving it for 2 days, then I'll be okay. Is this true, or
I'm not sure what you're spraying it with, but many of the antiseptic wipes and some of the antiseptic sprays will kill the virus. I don't want people to panic about mail and boxes because the load of virus seems to be pretty low, although it's possible that it could be there. If you could leave it, that would be ideal. If you could let it sit for a while. Many of the mail delivery people are very conscientious about wearing gloves and cleaning their own hands. So if you do touch it, I would just have some hand sanitizer or be able to just wash your hands. Washing your hands is just so protective. You almost can't do it enough. And most of the science shows you have to have a reasonable amount of contact with the virus in order to catch it. So we want you to be prudent but not panicked.
Great. Thank you so much. How about Alexia from Rome? Alexia, can you hear us?
Yes, I can.
You got a question?
Yes, I do. My question is, my doctor is starting me on a medication this evening to combat what they think I have COVID. Tomorrow morning, I'm supposed to go to do the drive-through testing located in Oneida. My question is, if I am starting the medication this evening, is that going to affect the results? Because my concern is because I have 3 small children.
Well, without knowing a lot of detail, I'm reluctant to give specific advice. There are no therapies right now that kill the virus. So I'm not sure what medication you're on, but I would anticipate that it would be best, but you need to ask your doctor if you're going to have the test tomorrow morning, that it would be best likely that you could wait to start the medication. But I would really ask your doctor that question because I'm not sure what kind of therapy he's putting you on.
All right, great. Thank you so much. We've got Raymond. Raymond, can you hear us?
Yes. Yes, I can.
You've got
First, thank you for all of your support in this time. My family is involved with the performing arts centers and things in the greater Utica Rome area. In particular, I'm associated with the Capitol Theater in Rome. And of course, early on in our fight against the virus and for our social distancing, those theaters and museums and performing arts centers were closed under order by the state. Our theater and many others are dependent upon the performance income that they're no longer getting because of their closings. We have 6 employees at the Capitol Theater, and those employees are dependent upon that income, and we're dependent upon that income to pay them. Does the Relief Act include nonprofit small businesses in its coverage? We're a little different many times from the normal small business, and we hope that the Relief Act will be available to the nonprofit small businesses, such as the performing arts organizations.
Yeah, this is Anthony. I could take that one. So small businesses and nonprofits are eligible for the economic injury disaster loans and have been in operation since January 31, 2020. They can receive a $10,000 grant from the Small Business Administration after applying for the economic injury disaster loans. So these grants will act as an emergency advance for small businesses and private nonprofits harmed by COVID-19. To access the advance, you must first apply for the economic injury disaster loan and then request the advance. The advance does not need to be repaid under any circumstance, even if the grantee is subsequently denied an economic injury disaster loan. Grants may be used to provide paid sick leave to employees, maintain payroll, meet increased production costs due to supply chain disruptions, or pay business obligations, including debts, rents, mortgage payments, things like that. Nonprofits are also eligible for the loans through the new SBA 7A Paycheck Protection Program. So I would say, yes, you are eligible, and our office can certainly help connect you with the Small Business Administration.
All right, great. Thank you so much. We've got Gary. Gary, can you hear us?
Yes, I can.
All right, you've got a question.
Yes, my question is, my wife has a couple of injections for her bones in her spine and back area, and one is at Lourdes and the other is at Wilson in the next week and a half here. What precautions do we need to take going into the hospital, and where would we go in to get into the hospital safely to get these injections done?
So, given this is a Lourdes question, I can answer specifically. So, we have, if the procedure is at the main facility, we have 2 restricted entrances: the main entrance as well as our MOB entrance. There is a screening protocol where it'll be asked some questions, and that's really to protect you as well as other patients and our associates. The other thing I would mention is, depending on whether the procedure is elective or not, you should just double check with your provider just to make sure that you're still on for the procedure. If you haven't heard, then you are likely on, but it's just good to double check because we are constraining elective procedures. And as for Wilson, you would need to contact them for their protocol, but really it's a screening on the front end, and what you will find when you come to Lourdes, and I'm sure many other providers, is our personnel are wearing masks to protect themselves as well as you as a patient, and we've organized any sort of waiting areas to really limit personal space so that we're keeping patients at a distance. But you can have that assurance that we're asking every patient that's coming into our facility those questions and doing that screening and making sure that we're managing the infection control aspect of this.
Great. Thank you so much. We've got a question from Elizabeth. Elizabeth, can you hear us?
Yes, this is a medical question. I have Crohn's disease, so I'm compromised with my low immune system. And I was wondering, if your doctor's office doesn't have a test for you, do they direct you to like the county health department, or do they direct you which way? Because the last couple of days I've had a slight fever and a sore throat, and she wants me to come in tomorrow to see her, and then they're going to go from there. But I'm wondering, if I go to their doctor's office, will I compromise them?
I mean, I can take this one. Your doctor's office, I'm sure, is taking the appropriate protective measures with masking and, hand hygiene. The frontline doctors, the primary care doctors, are all very comfortable now with managing it. They will likely want to ask a bunch of questions, potentially do an exam, and then direct you to have laboratory testing. Because we don't have unlimited laboratory tests yet, we're asking physicians and other advanced practitioners to do the evaluation first before they order the test, and then they can help you when the test results come back.
That's great. Thank you so much. We've got Joanne from Binghamton. Joanne, can you hear us?
I can, yeah. My question is to the doctor. When they talk about being asymptomatic, does that mean you can be asymptomatic and never get the virus, or is asymptomatic where you are fine a few days, but a few days later you get ill? Do you eventually get ill from the virus if you're asymptomatic?
If you are asymptomatic, it usually means that you have the virus and you're not exhibiting symptoms, and that happens in a smaller percentage of patients. 80% of the patients that get sick, and it can be ranging from a mild sore throat and headache to a nasty influenza-like illness, you will get better, 80%. The other 20% may have to be hospitalized, and then a smaller percentage of those people may end up on a ventilator.
All right, thank you so much. We've got Wayne. Can you hear us?
And was regarding the testing of the virus. And the accuracy of it. And I saw that Abbott had a testing kit that was going to be available soon, and then now you're saying it would be mid-April, that it will be in place for the testing?
So yes, from a Lourdes Hospital perspective for our community, there's what is called a reagent component to that test, and that is we're able to collect, but without that reagent cannot complete the test. And so our best understanding is that mid-April we should have access to it. But in the meantime, the Abbott test is being utilized in our sister facility in Chicago, and they're running a parallel test to ensure mutual accuracy. So we will have that information as well once the reagent arrives.
All right, great. We've got Linda from Windsor. Linda, can you hear us?
Yes, I can. My question is it true that one of the symptoms is pink eye? My daughter takes care of a baby that is compromised at home, and she was tested and is okay, but the mother now has pink eye, and she's wondering if the mother should be tested.
no, pink eye has not been associated with it. Now we're learning a lot about the virus, but pink eye is often caused by a virus, but not the specific coronavirus.
All right, great. Thank you so much. Sandy, can you hear us?
Yes, I can.
All right, you've got a good question?
Yes, I do. I want to know where locally, I'm in Binghamton, New York, where locally we can buy masks or obtain them somehow, since it's been recommended that we wear them when we go out of the house to do grocery shopping or whatever.
Most people are now making them or getting cloth masks. We're asking people not to buy the masks that the medical professionals would be using because they're in short supply. So there's a number of different organizations now that are making cloth masks. If you can't make them yourself, people are using scarves and all kinds of different ways to cover up their face. You have to understand that they don't protect you necessarily from the virus. They often are best at preventing you from touching your face. They're like a reminder not to touch your face in the event your hands have been contaminated. There is some recent literature that people believe that maybe just through close talking, some of the virus would come out into the air, but it's a large droplet particle that even with a cough or a sneeze can only go a few feet. That's why we've been advocating this 6-foot physical distancing.
All right, great. Thank you so much. We've got Lindsay from Binghamton. Lindsay, can you hear us? Lindsay, are you there?
Yes, this is Lindsay.
Hi, you've got a question?
Yes, I do. I work in an adult care facility in Binghamton, and I know that we've been asked already to admit patients for rehab that are recovering from the coronavirus. And I know that a lot of the hospitals here in the area are still at half capacity. So wouldn't it be like in everybody's best interest to keep them at the hospital and do their rehab there to prevent anybody from getting it in the nursing home facility, because that's their home? And, it just seems.
Oh, I think we just lost her. I'm sorry. I think the crux of her question was about if residents in the nursing care facilities are recovering from COVID-19. She felt they should stay at the hospital. Comment?
Go ahead, Dr.
Yeah,
Cronin.
you want to take that? Well, it's your area. I can add in after you.
So I was going to approach it more from a capacity perspective. So, in the short run, and certainly every facility is different. In our local facilities, right now we are, having some sporadic impact, and certainly it's increasing. I think on principle, it is important that we keep the flow moving as quickly as possible to the correct venue for care. And while in the short run we may have some capacity right now, with the anticipated surge, that capacity could disappear very, very quickly. And just to give you some perspective, in our ICU, we went from, a very limited capacity of 20%, limited use of that capacity of 20% to over 120% in a matter of 24 hours. We were able to manage through that. But that pressure will continue. So it is important that, every caregiver in our network is providing top of licensed care and to maintain that flow. So that's strictly from a capacity perspective. Dr. Cronin, you may be able to better speak clinically.
Well, I don't think anybody's going to be sending an infectious patient to a nursing home. But the minute the patient has been cleared as non-infectious, I would agree. We need to get our hospitals emptied out as fast as possible, because we are going to get a surge that is going to completely overwhelm our hospitals in the next couple of weeks. We're in communication with the hospitals in the New York City area, and it's a literal war zone there. They've turned every conceivable inch of their hospitals into intensive care units, and they're expanding in outdoor tents and so on. So we would never transfer a infectious patient into a nursing home, but the minute they're able to be discharged safely, they need to move on.
All right, great. Thank you so much. Well, our time is flown, so I think I'm going to take the last question. We've got a question from Chad. Chad, can you hear us?
Yes, I can.
You've got a question.
So, a lot of people with chronic medical conditions depend on the Medicare and Medicaid they receive through the Social Security disability, and Social Security. These people also work part-time. How is that added unemployment benefit going to affect their eligibility for Social Security and Social Security disability?
But I can take that one. So my understanding is that it should not affect it. The stimulus, I know the stimulus payment will not affect, so the direct cash assistance will not affect anybody's eligibility for any of the assistance programs. The unemployment, that's a good question. That's something would have to look into a little bit more on that one for you. So if you can, just follow up with my office and we'll get you a more direct answer on unemployment. But I can tell you, in terms of the stimulus payment, that will not affect your eligibility for any of those programs.
All right, great. Thank you so much. Well, our time has flown, but if you weren't able to ask your question, please remain on the line to leave a message. Also, our Utica office number is area code 315-732-0713. And I just want to turn it back to the Congressman for some final remarks.
Thanks, Sarah, for moderating tonight. And I want to thank all of you for joining us. We had some great questions on the line tonight, and we had a real high volume of calls. So unfortunately, we were not able to get to everyone. But if you stay on the line, you can leave a message, and we will get back to you. So if you have questions or need assistance, please call my office at area code 315-732-0713. We are here to help you. I want to thank our experts for taking time to join us tonight and provide resources. Thank you, Dr. Corona and Mr. Mills. Your work is very important, and many of you work year-round to prepare for events like this. So thank you for your work. It's critical. Thank you, everyone, for being on the call tonight, and stay safe.